afternoon. It's great to be back in Northeast Florida, kind of where we started this. How many was that? 4 or 5 weeks ago?
I think it was nearly 3 weeks ago.
3 weeks
I
ago.
think. Yeah.
So we knew that that what we were doing to protect long-term care facilities, while necessary, was creating a lot of angst, a lot of loneliness, a lot of pain for a lot of families. And so Mary Daniel helped lead this task force to plow a way forward. Mary Vahue, we have, of course, other members here with us today. When we look at kind of the approach that we've tried to take to this and other issues, I mean, our top priority from the very beginning was to protect our most vulnerable, and that's because COVID-19 disproportionately affects folks who are elderly, particularly those who are elderly that have underlying health issues. And so that was a priority from day one. And so we had to make decisions very early on in March about how do you approach this. So we did a couple things immediately. One was we prohibited, because remember there was a lot of concern about hospital overcrowding, and so people were supporting policies at that time to free up as many hospital beds, including some states had policies to force nursing homes to accept COVID-positive patients. We did the opposite because we knew that represented a hazard to our most vulnerable, so we prohibited hospitals from discharging a COVID-positive patient back to a long-term care facility. We also required the wearing of PPE by all staff in the facility, and we sent, over the course of the pandemic, we put our money where our mouth is. We sent them over 10 million masks, over 1 million gloves, 500,000 face shields, 900,000 gowns. That's just to long-term care facilities in the state of Florida. And then kind of the third thing that we did right off the bat was prohibit visitation to long-term care facilities. And I remember when we announced it at the time, I kind of had a pit in my stomach because, one, it represented the gravity of the situation that we were dealing with. It represented an acknowledgement of the risk that our most vulnerable were facing. But it also represented an action that would keep family members apart. And we were looking at a situation that didn't have a time limit on it. We didn't know how long we would need to do this. And so it was a very difficult thing to do. I think in hindsight we had to do it. I think it was the right thing to do. I think what we did, combined with the testing that we've done in the nursing homes, keeping testing the staff, having COVID-only dedicated nursing facilities for safe isolation when you do have a positive resident, I think all those things have been very important, and I think it saved a lot of lives. But when you're looking at these things, it's not all whatever you do to stop COVID and it's good. You've got to look at other things as well. One of the things, so protecting the vulnerable was the top priority, and obviously these facilities are the tip of the spear. We also understood the need to make sure that we had hospital capacity. So even though we were barring hospitals from sending COVID-positive patients back to nursing homes because we understood the risk of that, we were creating COVID-only facilities that they could successfully discharge people back to safely, where they knew how to handle COVID patients and where they weren't risking infecting other seniors. And then, of course, we did a lot over the many weeks and months to help support our frontline healthcare workers, whether it's PPE, whether it's additional staffing, particularly for areas that were having a lot of hospital traffic in July, and then bringing in a lot of medications when they were running low on things like remdesivir. I'd call the president, we get more down here pronto. And so that was very, very important. And then the third kind of principle that's guided us on this is to understand that to do well fighting a pandemic, you need a healthy society. It can't just be focus on one virus to the exclusion of everything else that we have going on. And so that meant things like keeping the economy going, which we've done over the last couple months and have continued to add jobs. It means giving parents the option to send people in person for K through 12 instruction. It means having universities that have students in person. It means continuing to do things that are going to strengthen our society, and because I don't think you can fight a pandemic very well when society is in the fetal position. And part of having a healthy society is understanding that human beings seek affection, that you have family members who, and many of the folks understand that they have loved ones who are in the last stage of their life. They're not demanding a medical miracle. They're not having unrealistic expectations. They just would like to be able to say goodbye or to hug somebody. So it was, you know, I think it's difficult to think that some of our actions may have prevented. So do you want to?
Thank you. I am incredibly grateful to be here, to be a part of this. The support that we have received from you, your heartfelt, true support from the rest of the task force. Secretary Mayhew, you have been amazing, the way that you led us to come to where we are today. It has been 175 days. And I am absolutely thrilled. I'm going to cry myself. This is going to be one of those days, I can promise you, when our caregivers for compromise see that we're getting back in. It's going to be as if the days hadn't happened, because that first hug and that first conversation and rubbing their back and holding their hand will take away the pain that we've all been suffering for these last 175 days. I am absolutely honored to be a part of this. I think our recommendations will be the blueprint for many states to come. We do have the Facebook group for every single state in the United States, and I believe Florida and Governor DeSantis' actions will show that we are the leaders in this and that we can do this safely. We are going to see some cases, I know that, but I also know that I want to be with my husband and everybody else out there. Hundreds of thousands of caregivers want to be with their families. And to be with them, to be able to hold their hands at the end of their life is going to be a precious gift that we're grateful to have back. So I thank you from the bottom of my heart. Thank you, Governor.
Thanks for your activism, and we really appreciate your story was tremendous, and I think you made an important acknowledgement. Look, on anything you do, there's going to be some risk, so we understand that. But we really believe that you can mitigate this risk by what the task force has recommended and by what we will require. But you have to weigh that risk, and I think it is a small risk, against the certain harm of prolonged isolation, of the certain harms of not allowing people to be with their loved ones. So I think it was a thoughtful approach, and I think it shows, just beyond this issue, you got to have a can-do approach. Like, okay, we understand we're in a tough situation. We understand that there are obstacles, but we're going to find a way to do it. And I think this is probably the best, the best we could have hoped for at this stage. I don't think it's the end in terms of, what we could be doing going forward. But I do think that it was very, very thoughtful. And, I've had so many people tell me, just look, I've got a mother or grandmother, 90, 95. She tells me, like, I understand COVID. I don't want to get it, but honestly, I'm living to see my family. That's why I'm living, to see them. And so, you don't want to be in a situation where you're cutting off your nose to spite your face. I mean, this is very important, obviously, to the folks like Mary who are caregivers and family members, but those folks in these facilities. I mean, this is a huge part, of their lives to be able to have these interactions. So, it's going to be, it's not going to be without challenge to do it, but I just think that there's been so much demand to be able to get in and do this that I think they're going to really focus on doing it right, because when you have something taken away like that, and it's a month and then two and now people have a roadmap going forward, and I think people are really going to appreciate that. So that we appreciate that. Mary Mayhew, thank you for what you've done on this. Very early on in March, when there was a lot of uncertainty about what was going to happen, I think you've been instrumental in plowing a course that You know, the state of Florida can say we did everything that we could to protect the most vulnerable. We did not leave any arrow in the quiver. Anytime there was a good idea, we did it. We acted early, but then as there were more things that we could do, you know, we did more. And as we had more resources, like for testing, we increased that dramatically. So, so thank you for your leadership, and thanks for helping with this.
Thank you. Thank you, Governor, and thank you for all of your support and your leadership. I think what we all understand is that from the beginning of this pandemic, there were so many unknowns. We have learned something new about this virus every single day, and what we understood fundamentally, your leadership, your clarity of focus, was that our elderly were most at risk, that individuals living in residential congregate settings were most vulnerable to rapid transmission, and yet we also appreciated that we had facilities that didn't have access to PPE, that were still trying to adjust to ever-changing guidance from the CDC, from CMS, and so to try to protect and guard against the virus from getting into the facility, we made that painful decision around visitation. What we also understood is that no one could stop the clock, and that family members have been praying for this time. We understand that the restriction on visitation is absolutely counter to everything we promote. The human touch is absolutely critical. You know, I've shared throughout the pandemic, I had my 87-year-old mother living with me for almost 4 months during the pandemic. I also had my 25-year-old son living at home, and so I saw the multi-generational, but I understood how much my mother craved the interaction, and no one should be going this long without a hug. I'm so pleased with the work of the task force, the members of the task force. These are incredibly emotional challenges that we have faced, but the thoughtful engagement, balancing our concerns about this deadly virus against the need to support safe visitation. And I'm really pleased with the recommendations, with the report. I am confident that as people are able to visit with their loved ones, that there will be adherence to just the basics: hand hygiene, wearing a face mask. If they're an essential caregiver, or in there on a compassionate visit, they're going to wear appropriate PPE and adhere to hand hygiene, and we can keep our loved ones safe, but bring families back together. So thank you, Governor.
Thank you. Secretary Purdom.
Thank you, Governor, and again, echo my gratitude for what you've done. I've never seen government move so quickly as you did in the last 10 days. So you kept us on task, but more than important, you kept us focused on the task at hand. So it was really a privilege to be part of that. But I know that since this pandemic began, it's been a constant precarious balance in that between limiting the spread of the virus and also the need for life to go on. And I think, Governor, when you came up with your Safe, Smart, Step-by-Step plan, that was an excellent plan, because it says to the virus, it will not confine us. It does not define us, and we have to move on. And then all of a sudden, Mary Daniel comes along and provides that human element to that we cannot let this virus confine us and define us. And so she brought that to us, and all of a sudden, we're sort of like, this is what this is all about. And that's what energized us. That's what energized this lady here and the rest of us. It was a privilege to be part of that sort of dialogue. We made time because it was important to make time. And thank you for that, because, we've been all working really hard to try and focus on every day, day in, day out, trying to address it. Then all of a sudden, you made it sort of, oh, this is the human side of this. This is why we're doing it. And all of a sudden, it made us sort of like relax a little bit, because we're like, oh, this is what this is all about. And then it refocused us and re-energized us. And so what you're seeing now is a result of that. So thank you for that. And I know that you represent, caregivers for compromise, a lot of individuals out there. So we're really excited about sort of seeing this. And, and you've mentioned before, there's going to be another virus. And you mentioned this as well, Governor. We are Floridians. We are very strong, and we are sort of determined. And we're not going to let anything confine us or define us. We are going to work together on resolving these issues. And this is going to make us stronger moving forward. So thank you for sort of, reminding us of what's important. And, we're just, it's been an awesome effort, and I'll always remember this. I will. So thank you, Governor.
Thank you. Michelle?
First, I wanted to say I hope Mary gets a chance to put her cape up, hang it up for just a little bit. But it's been such a privilege to get to work with you, Mary, and for your voice to be so apparent and poignant and articulate, and so many people needing you to speak up for them. So, here in Florida, Alzheimer's, we have the second highest prevalence for Alzheimer's and dementia in the country. And I told you 60% of the folks living in these long-term care facilities have some form of dementia. We've always been so thankful because the governor has come out so early on in the game to champion these efforts, and not just for people living with Alzheimer's and dementia, but for seniors in general. So I felt like what we needed to do in the beginning to be protective, to take care of our loved ones in long-term care, and then we got to a space, as Secretary Mayhew said, where this has been long enough, as you said, this has been long enough, and we needed to come up with solutions. So I was grateful to be on a task force that really got to that fast. And what I love about our leadership and our governor and Secretary Prudhomme and Secretary Mayhew is we do get to it fast. So we met, and I feel like here we are again today, just a short bit later. I could get choked up thinking about the pictures, thinking about you hugging Steve, and thinking about where we are today, and knowing what that quality of life, or what those hugs and what that touch and what that interaction is going to do for so many across our state. So we've done a lot to get to here that I'm very proud of, and I can't wait to see tomorrow. So thank you to all of you, to you, Governor, to you, Secretary and Secretary. It's an honor to get to be here today, so thank you.
Thank you. Gail?
Yes, Governor, thank you so much for keeping seniors in the forefront from the beginning. Every press conference, you mentioned seniors. They were right there in the front of your mind and everybody's mind, and we do appreciate it. And you, Secretary Mayhew, for your leadership, for this committee. This task force has done remarkable work. Secretary Prudhomme, of course, everything that you do as well. From our communities, we are so excited. I have to tell you, you have made over 100,000 seniors very happy today. And come tomorrow, they'll get to see their loved ones again and have some normalcy in their lives. So I'm just so excited. And Mary, thank you for bringing this to the forefront, and everything that you're doing to take care of your husband. It's wonderful. So thank you.
Thank you. We probably should talk about what actually the recommendations and what we'll actually implement. Did you want to do that and give an overview? Do you want me to do it? I mean, I can do it.
Please.
Okay. So, and if either of the Marys want to chime in, but just kind of the broad overview about what we're going to do. So, the baseline law in the state of Florida is you have the right to visitation. We obviously had to suspend that as part of the emergency to try to keep the COVID from going in facilities. And so we did have some exceptions, of course. So basically, this is broader exceptions to the original rule. So it's not back to fully normal, where but it is allowing the visitation, which is important. So all visitors have to wear the PPE and then pass through a screening. So the screening, of course, the temperature check, but as we know, not everyone has a temperature who has this. Some of the symptoms that they look for, maybe a cough, sense of taste that's been suspended, some of the other COVID symptoms, and then they do ask a series of questions about, have you been to a crowded private event or something like that recently? And so that is a really good way to be able to try to identify anybody who may be symptomatic. And obviously, if someone's really sick, that's obvious, but really it's kind of the very mildly symptomatic folks who may get sicker as time go on, but they're very contagious at that point. All visitation has to be by appointment only, and long-term care residents can designate up to 5 visitors with 2 visitors at a time for visitation. There's no minors at this time unless there's compassionate care exceptions. And I've told the committee, we'll see how this goes, but I personally would be very comfortable with minors. I think if you look at the way the transmission is typically gone, when every time they do sequencing studies, it's usually the adult infecting the minor rather than the minor infecting the adult. Now, obviously, a 17-year-old will be more likely to spread than a 7-year-old, but I'm very comfortable on an evidence-based perspective that that's something that we could get to very soon as well. No facility can allow visitors, though, unless 14 days have passed without the onset of a new positive case in either a resident or staff member. And the only exception to this 14-day rule is for essential caregivers and compassionate care visitors. So an essential caregiver is an individual who provides healthcare services or assistance with daily life, like bathing, dressing, and eating. A compassionate care visitor is intended to provide emotional support to help a resident face a difficult situation, such as end of life, a difficult transition, or some kind of loss. So this is trying, I think it's smart, it's incentivizing good practices on part of the facilities, because if you do that, then you're going to be able to have the visitation. Obviously, your residents' family members will be very happy with that. I think we've now gotten to the point where we obviously had more prevalence in July at our facilities, so the facilities, we have less prevalence
Yes,
now.
it's over 60% of the facilities that haven't had any cases over a 14-day period for either staff or residents, and that's an even higher bar than no new onset, so we expect that percentage to be even higher. And the other point that Mary championed during our task force discussions was for the essential caregiver, that those services include emotional support. And so as we look at that role and how important it is, we think about mental health in everything we do in supporting individuals. And because we have such a high percentage of individuals in our long-term care facilities who are suffering from depression, dementia, that emotional support is critical to their quality of life, to their health. So that was an expansion of that definition, that I think even if a facility hasn't met the criteria for that 14-day, you can have family members designated as an essential caregiver. They can designate 2. Only 1 can visit at a time, unless it's an APD, an Agency for Persons with Disabilities group home for individuals with intellectual and developmental disabilities, then they can have 2 essential caregivers at a time visit. So that was a significant expansion for both the compassionate care and the essential caregivers. So really pleased that will be authorized immediately.
That was a critical piece, I felt like, a critical piece.
And I would also just like to thank all the administrators, executive directors, and everyone that works in the communities for doing such a wonderful job, taking care of the seniors and making sure that they were safe.
And I guess, Governor, we know that as we've gone through this pandemic, we have seen so many providers rise to the challenge. And we have seen silver linings in the catalyst for change in the delivery of services. We talk often about telehealth, the dramatic increase in telehealth. Well, for our long-term care community, we have seen some catalysts for change around their approach to infection control, what they've learned from the new guidance from the CDC, from CMS. Our job is to help ensure that that gets sustained, that when the crisis isn't at the door, that commitment, the continuous quality improvement, continuous process improvement remains a focus. So we protect our elderly, those with underlying medical conditions, but we allow family members to be absolutely connected and part of their lives.
One distinction to make as well, that the essential caregivers versus the general visitation. The general visitation is the 5 people, 2 at a time. They must social distance, so there's a 6-foot requirement for them. The essential caregivers, which was something I was pretty passionate about, you may touch. So there is hand holding, there is back rubbing, there is hugs. So we're going to see a lot of that in the coming days. I'm very excited about that. One other thing I'm excited about, if you don't mind me chiming in, I'm turning in my 2 weeks' notice today. I'm not going to be a dishwasher anymore. I'm going back to being just a wife.
Well, well, we appreciate it. And I think it showed, that you were going to go through lengths to be able to be with your husband. Why shouldn't we go through whatever lengths we can for policy so that people like you all across the state, have the ability to be there with the people that you love. So it was a great inspiration, and I think that we'll put this into effect probably later today when I get back. I'll sign it, and obviously there are some criteria. So there's going to be some facilities that the remaining that still may have some lingering problems. Although, as Mary pointed out, once someone tests positive, it kind of lingers for a while. It doesn't mean there are new infections in the facility, and so we're looking at any new infections is really a thing. So there's going to be a higher percentage of these facilities that are going to be eligible right off the bat, and obviously have an incentive to want to keep it that way. Of course, it is easier to do it when the prevalence is declining in the community, and so when we were very low in May and early June, Mary and I were working on, potentially moving forward with some visitation. Then as we saw the prevalence increase at the end of June and into July, we saw that reflected, particularly in places like Miami, and the staff and in some outbreaks in some of these facilities. And so that was a difficult thing. Even though we wanted to do this earlier, it was difficult to pull the trigger under those circumstances. And so, the virus obviously isn't gone, but the prevalence from where we are now versus where we were at the beginning of July, it's just a much better situation for us. And we obviously want to continue to see it go in that direction. So we do want to see everybody's pictures, so you guys can work on that. And but we're just glad we were able to get to yes. So.
We should talk a little bit, though, about the dramatic reduction. So I think you pointed out yesterday during the press conference, there's been a 60% reduction in the number of individuals currently hospitalized for COVID since the peak. We've seen over a 40% reduction in the number of staff in our long-term care facilities who are positive. The positivity rate right now is about 1.2% among staff in our nursing homes and assisted living facilities, incredibly low. We have seen over a 30% reduction in the number of residents who are currently positive for COVID. Again, dramatic reduction from the peak. It's slightly over 3,000 individuals out of 154,000 individuals who are residing in our nursing homes and assisted living facilities. So the opportunity to thoughtfully develop these recommendations exists because of the progress that we've made.
Yeah, no, we have, if you look at the number of COVID positive patients hospitalized, you'd have to go back to June to find the level that we're operating under now. Some counties, if you look at their July peak, that they're much lower than their July peak. But if you go before their July peak, you'd have to go all the way back to April to find where they are right now, with this. And so those have been really good trends. And obviously, I think those trends on the hospitalizations were kind of signified by the decline in the people going to the emergency department for COVID-like illness, which we saw that peak that second week of July and started to go down. And now we're at levels like we were during the first 2 weeks of June. And so that's probably the best indicator about prevalence in the community, and I think that's a very positive trend that we did see early, and that really gave us confidence that we were going to see the hospitalizations plateau, and then of course we've really seen a dramatic decline. I mean, we were at almost 10,000, now we're at 3,400. So and yesterday was the lowest. So 2 days ago, the Sunday, which usually are bigger admission days, was the lowest admission since mid-June. Today was even lower, or yesterday was even lower than Sunday in terms of new admissions to the hospital. So that's way down from where we were at the peak. So those are all good indicators, and of course, the hospital capacity and the ability to handle, that was the number one reason we did all this to begin with. That's just said you had to flatten the curve, slow the spread so that we could kind of figure out how to handle this. And I think in Florida, we used the time in May particularly to do a lot of the infrastructure that we've seen. All the hospitals had PPE, they had medications. We had the COVID-only facilities. Of course, we had other stuff with long-term care. So even as we were at the height of this in July, there was never a question about hospital capacity. I mean, we had probably 12,000 beds at the low point, and we always had 15 to 20% of ICU beds available, and obviously that could have been expanded. So from that perspective, that was something that we monitored very closely, and we're very comfortable with where we are right now. I mean, that 3,500 or whatever, where we're at now, that represents probably less than 6% of all licensed beds in the state of Florida. And so it's very important. Obviously, those are all very important lives. But there's so many other health issues that are out there. And obviously, our residents in these facilities, they're dealing with a lot of these issues. And that's why they're just so important. I mean, if you have a family member has a terminal illness, you know the time is short. To just be told no, we had said before, I mean, that's going to leave a mark on people's lives, and it's a tragedy that happened. I think we had to do it, but I'm not happy about it, and I was resolved to do something about it, so that's what we've done.
Governor, we should talk about it too, and again, I'll speak to my own experience with my mother. I never realized how important it was that she wanted to get her hair cut. And for months, and my mother has...
That's in here.
For months, she kept asking why she couldn't get her hair cut. And so this was an important part of our recommendations, is to bring back the beauty salons, the barbers, with all the protections for adherence to infection control and the PPE. But that's a critical component to this report. Also, medical services. We want to make sure that any medical services that need to be brought in to support our residents with critical healthcare services, that they are very explicit about that in the report as well.
And I think, Governor, we're going to set the tone for other states. They're already starting to look. Colleagues that I have across the country had asked for our report, very much interested in what we're doing, and I think we're going to set a trend for the rest of the country with this.
And Governor, thank you for initiating the testing in our communities.
Yep.
I think that was so helpful and very beneficial for this whole task force.
Well, and when I was reading the report, I mean, it never occurred to me about like the beauty salon or the hair stuff. But if you think about it, I mean, the family, of course, comes first. But then when you're in those types of situations where you're not able to have that interaction and a whole wide range of things, little things like that we take for granted, that matters. And that will bring a lot of satisfaction to a lot of people. And oh, by the way, we were told months and months ago how barbers and hairstylists were just going to be the scourge of spread. That hasn't been the case. They've been very good. They've taken precautions. And, I think in Florida have done a great job. So doing that, I think, will be minimal risk. But I'm really happy. The final thing I'll just say is, federal government, so we don't require testing. And the reason is because, if you go get tested and you get your results 2 days later, it says negative, you could have gotten infected between now and then. Now, there are point-of-care tests that the federal government is sending to not all long-term care facilities, but those skilled nursing facilities in the state of Florida. So they will have the ability, and I think a lot of them probably have it now, but certainly they're going to be getting it over the next couple weeks. So they will have the ability to do that. They are free to do testing for people that come in. And we're not discouraging that, but we believe that taking these mitigation steps, doing the screening, wearing the PPE, that is adequate. And quite frankly, not all these tests are entirely accurate. We do see false negatives, we do see false positives. So it's not a foolproof thing. If it's a false positive, you're denying somebody the ability to see their loved one illegitimately. If it's a false negative, then you could be a false sense of security. So they are going to have testing capacity at those facilities, and they may use it for this, and that's fine. I also think if you have proven antibodies, obviously that would be something, that I think facilities, if you have that and bring that in, they would really appreciate that, because that shows you that you're probably going to be in pretty good shape in terms of not being a live carrier. So, I'm glad that this came together so quickly. I know you guys had to work hard on it, and I think that this is kind of a model. I mean, this is the most severe mitigation that was done in Florida was done to protect the long-term care facilities. And as we've said, look, it had to be done, but that mitigation has costs, and so you got to figure out a way to continue serving the purpose of protecting people from COVID, but not shutting off all avenues of life beyond the virus. And so I think that we're showing we can do that here, and I think we're trying to show that we can do that, across the spectrum in the state of Florida. So I want to thank you guys again for all your hard work, and I'm excited to see some of the photos, and hopefully this brings a lot of comfort to the families and obviously to our residents in these facilities. With that, we're happy to take some questions. Yes, sir.
What information did the task force use to go ahead and make this recommendation on changing the visitation moratorium? Why now?
Well, I think why now is because I convened this and said we want to plow a way forward. And I think it's just a situation where part of it was just the sheer length that we've been in this for. But then I think added to that was just the uncertainty about, okay, when are we going to be able to actually step forward? I mean, I would say 6 months with a definitive end date would be a lot easier for people than doing 6 months with no end in sight. That's just the reality. And the 6 months was long. And as I said, it weighs on me to think of the people who passed away, nothing to do with COVID. Just this is a natural thing. These are folks who, are our most elderly, frail residents, passed away without being able to say a final goodbye. So we had to do something.
Governor, can you walk through the chronology? So you're going to sign the policy today, and then, so for a resident, family members who would like to take advantage of it, what's the timeline for when that would start and how it's going to start?
Well, I think the facilities, they obviously will be authorized. it's, I don't know if they're going to be ready at 5 o'clock today when I do it, although I'm sure Mary and her folks are ready to go. So, but bottom line is, once we sign it, it'll be good to go. Now, we're not requiring the facilities to provide the PPE to the visitors. We think the visitor, if you're going to visit, bring your own PPE. This is very, very prevalent in our society now. So do that, particularly when you're talking about a facial covering. But yeah, it'll be up to them to kind of get going. So hopefully, you'll have people in very soon. Now, they're going to have to meet the criteria of not having any new onsets over the last 14 days.
And all the policies that we're asking them to have in place, but it is effective upon the governor's signature of the emergency order. So our expectation is that facilities, if they need to work with any essential caregivers, any compassionate care visits, meet the policies, but absolutely respond to that expectation. If they have been clear for 14 days with no new onset, they need to have the policies in place to support general visitation, and they need to be moving with a sense of urgency on that.
I think it's important to mention as well is that the governor expects us to sort of continue to meet, to sort of see how this rolls out and to make those necessary changes as the situation warrants it. I think it's important that we continue to sort of check things out and make sure that we adjust as we see fit.
Absolutely. Yes, sir.
Governor, quick two-part question. The first one, if we've got, say, a nursing home, maybe see some cases, could the essential caregiver designation, allowing the two in, could that be something that is looked at, as a way to remedy possibly an individual facility that might see some cases? Well,
the essential caregivers are not bound by the 14-day rule. So yeah, they could go in and continue to provide that essential care. And I think that that's important just because, these are critical folks. And if there happens to be one case in the facility to kind of keep all those people out too, that would probably be tough. So we wanted to provide the avenue for that. I know Mary wanted that.
And one last thing, Governor, if you could, do you have any comments on the Department of Health cutting ties with Quest Diagnostics? I wonder if you have anything to say about that.
Yeah, I think it was the right decision. They dumped, I think, 75,000 test results dating back to April. And so it's like, okay, you're required to put this in, and you do it now in this big dump. And I've been preaching, be wary of some of these test results because it's about when the lab puts it in, they don't all do the negatives. But this is the most egregious dump we've had. And so there's people that are actually using this on a local level to determine, hey, school, this or that. And obviously, I think anyone should just take today's results and just put them aside because most of those were not recent results. But yeah, it's look, in defense of, I think, just this is not the way a lot of this information really was designed to be used. I think we've fallen into a trap because we do want data, which is good, but some of this data is just flawed. I mean, some of these test results can be dumped over many, many weeks, and in this case, many, many months. And we now know that just a positive test, it doesn't even mean you have live virus. There was an article in the New York Times this weekend talking about New York, Massachusetts, and I think Nevada. They studied all the positive tests that had happened over a certain period of time, and they determined 90% did not have contagious virus, even though they're positive cases. So these are people who are isolating for 2 weeks when they cannot spread the virus. And so there's a lot of problems with this. That's why what I've tried to tell people, particularly locally, and that's certainly how we're going to, we focus on better metrics than that are more credible. So ED visits to COVID-like illness. If we're at 400 a day in Florida compared to 2,500 at our peak, we know there's less prevalence. That's just, there's no way you can get around that. Hospitalizations, when you have a major decline, admissions tanking, you have fewer prevalence. These cases and the way these things are doing, and there's a lot of these companies that are making huge amounts of money. I mean, go back a year, they would have never thought they could have made this much money. The problem is when you're sloppy with it, it ends up impacting people's lives. And again, it shouldn't be that way, I think. I think that this data, is not the best data to be going off of in hindsight. And that's why I'm focusing more on the actual syndromatic issues. But boy, just imagine if we had not caught this and it goes, or another state it happens to, and then they say, oh, the positivity's too high, too many cases. You're not going to start school on time because of that. All because of a lab held these things for over a many month period. It's a big problem. Yes, sir.
Because Quest is such a big company, is this gonna have an effect on the processing capacity? Are private testing facilities still gonna be able to use?
We've had more success with some of the more upstart labs in terms of their turnaround time, so I think that there's a lot of options there. And I will tell you, when we were having the biggest backlogs were typically from Quest, even back in early July.
Governor, in terms of the visitation now, I'm trying to get a visual image. When you have these reunions, are people going to be able to walk up and hug the grandmother or grandfather, or are they going to be 6 feet away? What's it going to be like for these family members to finally get back with their loved ones in those quarters?
Well, I'll let Mary talk about the rules, but I mean, my view is there should be maximum amount of that type of affection and personal interaction. I mean, the fact of the matter is, we know how this virus spreads. If you go up and hug somebody, as long as they're not sneezing and you or coughing and you're coughing in them, that's not prolonged enough exposure to be a really high risk. It doesn't mean it can't happen. Obviously, these things can, but I think having the ability to do some of that is very important. The surface, I know we focus on like the hands and stuff, and that's good. It's good hygiene, and it's important. But like in terms of like getting it off a surface or me touching somebody, you're more likely to get it through those droplets or the aerosols. So I'm in favor. I know the caregivers and stuff. I mean, I'm in favor of it. I just think that it's really important to have that. And in some respects, it's like some of these places you could go like look in the window and wave, and it's like, okay, that's fine. But I mean, it's almost like, okay, you're this close and then you just can't do that, because when you do that, I think both, but certainly the resident, I mean, that's just going to be, a huge, great feeling to have somebody, that you know and love be there for you. I think Mary was talking about, she was in the facility. I don't know if she wants me to say this, but she was in her, and there was an elderly woman. The woman who, she just wanted a hug. She just asked for a hug. So Mary gave her a big hug, and that really made a difference to her. Because of all she's been through. So I'm in favor of that.
It's amazing, after all these months, I mean, this is someone that's very frail, and I was directing her back to her room. I was leaving my dishwashing job, and she said, I said, come back in here, let's get to your room. And she turned around and looked at me and said, will you give me a hug? And I almost didn't do it. I thought for a second, oh, I might get in trouble. I had a mask on, and I did. I gave her a hug. And I said earlier, it may be one of the best hugs that I've ever given. I mean, this is a real sign that people need touch. She actually articulated, will you please give me a hug? So it's going to be needed. As essential caregivers, that's exactly what we're going to do. We will be able to, the 2 essential caregivers will be able to touch them. We'll be able to rub their back. We'll be able to hold their hand. And the general visitation, not yet, not right now. That's a larger number of folks, and so we want to kind of limit that right now. I'm hoping that in time, we're going to prove that this is really working, and we'll be able to change that as well.
Does the task force have a timeline on when full visitation will be, is there any sort of estimated timeline?
No, and so I think it's really important that what Florida has done throughout the pandemic is to respond to the Florida situation, the Florida data that has driven. We have been nimble in responding and changing the guidance in order to be reflective of the current situation. The task force was very clear about doing this thoughtfully and slowly and then monitoring and being ready to come back with any updates or recommendations to open it up even further. But that we need to have this get started, monitor and evaluate, make sure that best practices are being adhered to, and then see in the next few weeks what other changes we may want to entertain.
All right, well, we appreciate everybody's efforts. I know it's been a long many months, and it's not been easy, and especially when we knew what was going to happen. We didn't know, and this was a very difficult time for everybody, and we were plowing ahead. We wanted to make sure that this was a priority to protect these residents in those situations. And we did that, and obviously even the best efforts there. I mean, you're never going to have zero out. When we had in July, we had some. We've had them across the whole time. We've been able to mitigate and been able to save a lot of lives at the same time. But looking at the impact, I mean, it's just thinking about it. Like in some respects, I was thinking about the press conference when we announced this. That seems like 2 years ago.
Yeah.
I mean, because so much has happened.
Yes.
So can you imagine if you're in these situations where you're not able to have to see the people that you love, and so it just needed to be done. But it was a long time coming. If there was an easy way for me to just snap my fingers along the way, believe me, we were discussing it in May and June, and we just didn't quite get there. And in hindsight, it may not have ended up working out as well had we done it there. I don't know. Maybe it would have been fine. Who knows? But you make these. So with COVID-19, it was basically you're hospitalized for any reason. Now, some of those policies have evolved over the last many months. I think more and more hospitals are on board with allowing family members to come in end-of-life situations, which I very much support. I mean, imagine being in a hospital in that situation and literally have nobody there to be with you. But it's also a situation, I mean, if you have somebody that gets in a car accident and they're stable and they got to be in the hospital, people want to have somebody to know places. I just think at a minimum, I think everyone needs to have a friend of life. But even in some of these other situations, it really does matter to be able to have a family member there with the patient. And there's a lot of people, I mean, you end up in the hospital, particularly the first time you've ever ended up there, it's not an easy thing to deal with. Even if you're going to end up, even if your mortality is not an issue, it's still not an easy thing to deal with. And so we want to be able to see that visitation as well. And I know some facilities have done more than others, but I think we understand that if we want to get it done, we can get it done. They know different procedures, they know different things that can be done to mitigate. But I think that's part of it was with COVID. The difficult thing was the loneliness it created in these facilities. But then you have people who would end up hospitalized with other things too, but particularly COVID. And it's like it's a total isolation area. Like you don't let anyone to come in other than the medical staff. So we had a lot of medical staff that were really there, kind of serving as de facto loved ones to give them company in very difficult times. Some of them at the end of their life where they passed away. Others where they were really fighting and ended up coming out okay on the other end. But that is a very difficult situation. So I think that the end of life has made a big difference in the hospitals that have done it. I would say go beyond it. I mean, if you have a parent in the hospital for a couple days, they want to see people. I mean, I think about when we had our baby, a March 20 spot where, you know, some of those really key life